Good morning, good afternoon, good evening, depending on your location. I remain your fertility counselor, Opera Stella Telma Chikodi. Since 2 days now, we have been talking about fibroid. We have been creating awareness on this fibroid issue. So, we are still on it. So, I really appreciate everyone who have been following up this section in this creating of awareness. Fibroid is not a death sentence. It is treatable. And fibroid cannot hinder you not to conceive if you take the right step. If you do the right thing, you will get the right result. So today we are talking about the symptoms of this fibroid. A lot of people have this fibroid, but they don't know because they don't see any symptoms. Some people may be feeling pains in their pelvic region, abdominal pains, but they may not know the cause of those pains. Many a times, before you start seeing symptoms of this fibroid, maybe it have grown to the extent it will be pressing other organs in the body, like the bladder or the rectum. Before you can notice that you are having such problem. Some people only discover through pelvic ultrasound, or maybe they have hormonal imbalance. On the process, on further examination, they will discover that they have this inflammation in their body. So many a times, symptoms are not visible. The symptoms are not visible, yes. The symptoms are not visible. So you cannot just conclude that you don't have this benign growth without confirmation. Some people it years in their body, but they don't know. They don't know. Some people find out that they have this fibroid, maybe when they go for a fertility test or in a situation where they're struggling to take in and it's not working out as it's supposed to be. And they discover on the journey of the diagnosis, and many of them, they discover that they have this growth in their body. So today we are looking into the symptoms of this fibroid growth. What are the symptoms of this fibroid growth? Number of symptoms I have here with me. Any person that is having this growth in his body, the tendency that will be having heavy bleeding while menstruating. And this heavy bleeding, we call it, this heavy bleeding can lead to anemic reaction. There are some people that experience this every month. They run shortage of blood. Every month after their menstruation are always heavy. So when you discover that you normally have heavy flow and you bleed more than normal, some people that menstruation end in 10 days, abnormal bleeding just like that lead to anemic reaction. That means a situation where you lose blood and you have to regain it back again. All these things are part of the symptoms. I mentioned here heavy menstrual flow, number one. I have number two here is abdominal pain. When you discover that you're having abdominal pain, one thing you need to know is that you need to go and check. Don't conclude or be taking self-medication. Maybe taking self-medication that when you take this medication, it will end it. My dear, please, you need to go for a proper diagnosis. Whenever you are having abdominal pains, something is inside there. Something is triggering that pains. You need to find out what is causing that pains in your body. So you are being encouraged to find out today. Number three symptoms I have here today is pressure on the pelvic, which leads to cramping. A lot of people have menstrual cramp. While menstruating, you have a terrible cramp before your menstruation or during your menstrual period. This is also a sign there is an inflammation in that body. We also have pelvic pains. Pains, when you are having pains in your pelvic region. When you are having pains, always something is wrong. And lower back pain. Some people, it will come on their leg. It will be paining them. Yes. All these things are the symptoms. Your symptoms and my symptoms may not be the same. But any reaction you see in this, your abdominal region, is a concern that needs to be to know. You need to know what is the cause of the problem. Another one is bloating. Large fibroid can cause a visible tummy bloating. Yes, your tummy can be bloated. What do I mean by your tummy can be bloated? You can have bloated tummy. If you eat small food, it will just bulge out. People will be asking you whether you are pregnant, but you are not pregnant. This can be as a result of this growth, this attachment in your body. Yes, it can be as a result of it. So when you discover they're having bloated tummy, something is inside there. Your tummy cannot just be protruding, coming out just like that. Something is inside there. Something is causing that bloating in your tummy. Or when you eat small food, sometimes you feel like you have gas in your tummy. A lot of reactions, you feel uncomfortable. It can cause discomfort to you. So when you discover all these signs, you need to go for pelvic ultrasound to check your body. And another one is urinary problem. Many a times it causes frequent urination. When you are urinating often, because this growth have grown to the extent there will be a pressure in the bladder. And when this pressure, especially subserous fibroid, it causes pressure in the rectum and the bladder. And when this pressure will be there, it will cause frequent urination for you. And another one we have here is painful bowel movement. You keep on having a painful bowel movement. Yes, a movement in your tummy which is unknown. Something is wrong. Something is wrong. You need to find out why you are having that bowel movement, bowel sound. Sometimes you gas in your tummy, a lot of things, but your tummy cannot rest. Something is wrong. So another symptom we have here is miscarriage. I have to discuss here extensively. There are a lot of women that are having miscarriage. Till today, they're still confused. You have your first miscarriage, your second miscarriage, and third miscarriage. You thought it's a spiritual matter. My dear, wake up from that sleep. You can't just conclude. You can't just be gazing. Please, can you wake up there and go for pelvic ultrasound to know why why it is so? A lot of people, their fibroid growth have occupied the space in their tummy. To the extent it will not allow any baby to be there. Many a times, some people struggle to conceive with it. At the end, they will have premature birth. Not just premature birth, it will lead to a very painful, the pregnancy period will be very painful for them. So you don't keep on having that mistake. And if you struggle till the end, you will end up giving birth with cesarean section. It must come with surgery. So why should you keep on waiting? Why should you keep on struggling where you know that you can overcome all these pains? So if you're having constant miscarriage, I encourage you today to go for pelvic ultrasound. The last and not least is infertility. When you see a woman, the husband is okay, a fertile man, A man that is okay, your sperm count is okay, everything is normal. At the end, your wife is not working. My dear, you need to go for further tests, not just a fibroid test. You need to go for a fertility test. I want you to watch my next video, the necessary tests you need to undergo if you are having a fertility issue as a woman. So I encourage you all today, when you're having a fertility, it's not only for women, also male need to undergo this test to make sure they get the rightful solution that will give them evidence, not just I took that drug, it's working, it have worked, but there is no evidence. Your evidence is when you carry your baby, when you have your child in your hand. That means the evidence is there. That means the evidence is there. Some people used to have pains during sexual intercourse. Fibroid growth can cause pain during sexual intercourse. When you are having sexual intercourse with your partner and you don't feel comfortable, when he insert his manhood inside your body, you begin to feel pain. That is growth. There is something inside there that is causing that pain. Because if it is normal, you will not feel the pains. So, some people have this fertility problem associated with fibroid. Fibroid may cause a lot of this thing, a lot of problem during pregnancy, cause preterm labor, as I've said before. So please, I encourage everyone, all these symptoms I've mentioned here, if you're having all these symptoms, please, you need to consult your fertility counselor for what next to do. If you don't know what to do next, you need to consult your fertility counselor. And if you have already gone for all these fertility tests and you are still having those symptoms in your body, you need to go a further examination. You meet your gynecologist to find out what is actually the cause. I, as a fertility counselor, I am here to tell you the truth, the rightful thing you will do to get the results you need. Not just a result, but to carry your baby, to have evidence. The right test you need to go. I have said it before and I'm still saying it again. No herbal medicine can dissolve fibroid. No herbal medicine can dissolve a fibroid growth. Rather, it will cause more harm to your body. It will cause more harm to your system. Don't allow anybody to deceive you. Fibroid is not a death sentence. God have made it to be so. Only God knows how and where and how it transpires. So if you're having such challenge, please don't give it a second thought. I keep on telling people the proper treatment for this for fibroid is surgery. And when you go for this surgery, you maintain your diet. I promise you 10 years, 5 years, you will not see that regrowth again. But when you keep on eating anyhow, that is why you need to meet a fertility counselor. We are going to give you a meal plan. What you will eat, you ovulate very well. 6 months you will take in. It is possible. You are not the first, neither the last. If it have happened to other people, your own is sure, but you are not doing it right. So if you're having all the symptoms in your body, please don't wait. Contact us today. Contact us. You can drop your question. You can drop your anything you want to ask me. I will see it and reply you. Not just replying you, I will tell you what to do. Schedule an appointment with us today and you will not regret it. You will not regret it. So if you're having all the symptoms in your body, come. We are here for you. We are ready. And we are here to help you to get the best. So let it be so. So as we are creating this awareness about fibroid, you may say you don't need it. You need it. Somebody around you may be having this challenge, may be having this issue, but she don't know what to do. You can listen to this and also encourage that person. You can link him up to this channel. You can link him up one-on-one. We talk to you one-on-one, online. So that is what I have for you today. By tomorrow, we are going to be talking other diagnosis, the rightful diagnosis you are going to do if you are having all the symptoms in your body. and the proper treatment. And we have optional treatments. That is why you need to meet your doctor. There are many options we have for this treatment. So the one that is suitable for you, your doctor will encourage you, will help you, and advise you well. And I believe you will get the result at the end. So thank you so much for being part of this section today. By this time tomorrow, we are coming back again. I hope this information is educative to you and you are getting something from it. Please don't fail to drop your comments, your question on the comment section. Thank you for being part of this section today. Thank you so much. Once again, I appreciate you all. You will get your testimony. You will get your results very soon. Through this channel, God will reply and give you evidence.